Public health video. My name is Jeremy Chavez, and welcome to Chavez Health Access, where we believe informed decisions equal better outcomes. Let's get you covered. So today I'll be breaking down Covered California, the state's official health insurance marketplace under the Affordable Care Act. If you've ever been confused about how to enroll, how financial help works, which plans are best for you, or what deadlines matter, this video is here to guide you. My goal is to give you clear, accurate, and practical information so you can make confident decisions about your health coverage. So first, what is Covered California? Covered California is essentially the place where Californians go to compare health insurance plans, apply for financial assistance, and enroll in coverage. Instead of calling different insurance companies individually, Covered California puts everything in one place: prices, benefits, networks, discounts, and it lets you compare plans side by side. Before the Affordable Care Act, many plans didn't include essential benefits like maternity care, mental health treatment, or prescription medications. After the Affordable Care Act, every plan sold through Covered California must include these essential services. And California was actually the first state in the country to launch its own marketplace when the Affordable Care Act took effect in 2014. So Covered California was created to make coverage more accessible, more transparent, and more affordable overall. And it's played a major role in lowering the uninsured rate across the state. Now, something that makes Covered California especially unique is that it uses a model called active purchasing. This means that the marketplace usually actually negotiates with insurance companies every year to keep premiums reasonable. Insurers must justify their prices and meet quality standards before they're allowed to sell plans through Covered California. This system helps prevent the major premium spikes that some other states have experienced and keeps coverage more stable for Californians. Now on to our second slide. Who is Covered California for? It's for everyday Californians who don't get affordable insurance from an employer. That includes students, freelancers, contract workers, part-time employees, parents, and even people who have just aged off their parents' plan at 26 years old. If your job doesn't provide health insurance or health coverage, or the coverage that they do offer is out of your budget, then Covered California is designed for you. Moving on to our enrollment dates. So let's talk about enrollment, one of the most important parts of this system. Open enrollment for the 2025 to 2026 cycle runs from November 1st, 2025 through January 31st, 2026. During this period, anyone can apply for coverage. California often adds a short extension into mid-February, but it's always better to enroll early to avoid delays. After open enrollment, you can only sign up if you qualify for special enrollment, which requires a qualifying life event. Examples of these include losing job-based coverage, moving to California, getting married or divorced, having a baby, turning 26, or gaining lawful presence, that is to say, becoming a documented immigrant. If you qualify, your coverage typically begins the first day of the following month, choosing the plan. After choosing the plan. On to eligibility requirements. So to qualify for Covered California, you must, one, live in California, be lawfully present, that is to say, not be undocumented, and not be incarcerated, and not have access to affordable employer insurance. There is no minimum income requirement. The application automatically checks if you qualify for Medi-Cal, which has income limits than most people would expect, especially for families, young adults, and students. Many people end up qualifying for it without even realizing it because they didn't even know that their income was eligible. So let's discuss our essential health benefits. One major advantage of Covered California is that every plan is required to include the 10 essential health benefits. These include emergency services, hospitalization, prescription drugs, maternity and newborn care, mental health treatment, primary care visits, preventative services, pediatric services, lab tests, and rehabilitation services. Preventative care, like vaccines, screenings, and annual checkups, is covered at no cost to you. So now we're moving on to slide 4, where we're going to talk about financial assistance or subsidies, as they're called. So this is where Covered California really makes a difference. Most people who enroll receive federal premium tax credits that reduce their monthly payments. These discounts are based on your income, your household size, your location, and the plan that you choose. California also offers state-level subsidies, which help middle-income households, even people making 60, 70, even 80,000 or more, lower their monthly costs due to these subsidies. A plan that normally costs around 500 to 600 a month might drop to around 90, 120, 150 once the subsidies are applied. So this is why about 90% of enrollees receive financial assistance. These programs make healthcare accessible to millions of Californians who would otherwise be uninsured. So here is our Covered California enrollment data, basically. Let me just discuss another important feature of Covered California is that it uses standardized plans. So this means that every insurer must follow the same structure for bronze, gold, and platinum plans. A silver plan from Kaiser will have the same basic copays and deductibles as a silver plan from Blue Shield. This makes comparing plans much easier because the benefits are consistent. You're not having to decode 20 different cost structures and juggling all these websites. You can focus on price, network, and quality ratings. Now, let's look at some real data from Covered California's 2024 enrollment report. 1.7 million Californians enrolled in marketplace plans in 2024. 90% received financial assistance. The average enrollee paid $134 per month after subsidies, and enrollment increased the most among adults aged 26 to 34. This shows that the marketplace is not only being used, it's working effectively to make coverage more affordable and accessible. Studies also show that people with marketplace coverage have better access to preventative services, use primary care more often, and are less likely to rely on emergency rooms. This improves individual health and reduces overall system costs. Now, I'd like to go over the application process. So here's how to apply. Step 1, you visit coveredcalifornia.com. That's coveredca.com. Step 2, you need to create an account and provide personal information. They'll ask your birth date, things of that nature. Step 3, you enter your household income. Step 4, you compare plans using the built-in tools on the website. And step 5, select your plan and submit the application. You can apply online, by phone, or with free assistance from certified enrollers. That's my purpose right now, is to kind of guide you through the process. So going more into depth on these plan types, Covered California offers 4 plan tiers: bronze, silver, gold, and platinum. Bronze plans have the lowest monthly premiums, but higher out-of-pocket costs. Silver plans offer the best overall value, especially because of something called enhanced silver. Gold and platinum plans have higher monthly premiums, but very low copays and deductibles, making them ideal for people with ongoing or chronic conditions. Another really important point is that enhanced silver plans offer reduced deductibles and lower copays for eligible households. But you only get these savings if you choose a silver plan. Many Californians qualify without realizing it, and it can give you near gold or platinum level coverage for a fraction of the price. So it's helpful to think just beyond the monthly premium. Your total annual cost depends on how often you visit doctors, whether you take prescriptions, and how you typically use the healthcare system. Covered California has tools that estimate your annual cost under each plan based on your healthcare usage. This helps you choose a plan that matches your real health needs and not just the lowest sticker price. So I'd like to go into depth about HMOs and PPOs. Another thing to consider is the type of network. Most plans on Covered California are HMOs, which require you to choose a primary care provider who coordinates your care. PPOs give you more flexibility, including the ability to see specialists without referrals, but they tend to cost more. Understanding this can help you pick a plan that fits your personal style of receiving care. So, what happens after enrolling? After you enroll, your insurance company will send a welcome packet and an ID card within 10 to 14 days. At that point, you should make an online account with your insurance company, choose your primary care doctor if required, review your copays and benefits, set up your monthly payments, and explore telehealth options, which many plans cover at low cost. So, Covered California also provides quality star ratings for each plan based on customer service, preventative care usage, chronic disease management, and overall member satisfaction. These ratings help you understand not just the cost of a plan, but the quality of care people receive once enrolled. So let's take a look at a real life example. A single adult making around $32,000 a year might see a plan priced at about $500 a month. After subsidies, their cost might drop to around $90 to $140 a month. That's a significant amount of money saved every single month, and it provides dependable access to doctors, pharmacies, and preventative services. Now, from a public health perspective, marketplaces like Covered California reduce financial barriers, encourage preventative care, improve chronic disease management, and reduce avoidable hospitalizations. It doesn't just help individuals, it improves community health statewide. On to some smart enrollment tips. After enrolling, before enrolling, you should apply early. Do not wait until the last second. Have your income documents ready. Check whether you qualify for Medi-Cal. Make sure your preferred doctor is in network. Use the shop and compare tool on the website. And save your login info for renewals every year. Covered California exists so every Californian has an opportunity to access affordable, high-quality healthcare. Whether you're a student, a worker, a parent, or even in between jobs, you deserve coverage that supports your health and your lifestyle. My name is Jeremy Chavez, and this is Chavez Health Access. Informed decisions equal